Hello, everyone. Thanks for joining us today. We'll start with Governor Pritzker.
Thank you. Good afternoon, everyone, and welcome to the COVID-19 update for Wednesday, November 25th. As a reminder, we won't be holding these briefings tomorrow or Friday in honor of the holiday, but IDPH will continue to update the daily numbers online and post news releases on its website. Although Thanksgiving looks a little different than last year, I do hope everyone will still share special time with their loved ones who live elsewhere and do it by FaceTime or Zoom or whatever communication method you may choose. And I want to wish you and yours a healthy and safe Thanksgiving holiday. I'll kick it off today with a fiscal update regarding our state's finances. As you may know, there have been two distinct negative effects on state government finances since the start of the coronavirus pandemic. The first is the state's need to provide protections to the public in the form of goods, like PPE distribution to first responders so they won't get sick doing their jobs, and ventilators for those who are gravely ill with the virus so that we can keep them alive, and supports for small businesses so that they can keep their doors open, and rental assistance programs for people who have lost some or all of their income because of the economic effects of the virus. Those are just a few examples of the unusual expenditures that are directly caused by the pandemic. The federal government provided an initial program called the CARES Act that gave direct funds to states and local governments to partially reimburse us for those specific kinds of pandemic-related expenses. The second negative effect of the coronavirus pandemic has been a massive loss of tax revenue to state and local governments in Illinois because of the virus. The funds that support our normal state expenditures, like schools, roads, police, social services, and healthcare, that's what's been lost. Like many other states, Illinois has suffered job losses due to the virus, fewer purchases of goods, and the complete shutdown of our travel and tourism industry, all of which have negatively impacted state revenues across the board. The COVID-related loss of tax revenue to the state has cost us more than $5 billion. But despite great need across the nation, there's been no federal reimbursement program for these pandemic-related losses to state and local governments, at least not yet. Every state suffered revenue losses just like Illinois. For months now, I have worked with governors of both parties and spoken countless times with members of Congress and the U.S. Senate to aggressively advocate for direct federal aid for state and local governments who have lost billions of dollars in revenue due to COVID-19. But while we wait for the Congress to act, and even without their support, governors must also work with the tools that we have to cover the COVID-related loss of revenue so that we can balance our budgets and support our residents in this time of great need. The stimulus that Congress may provide should be aimed at the challenges brought on by COVID-19, not the problems that states had that predated the virus. For many years before the pandemic, our state has had a structural deficit. And from the beginning of my term in office, I've worked hard to bring long-term permanent solutions to the table, including implementing efficiencies to lower the cost of government, reducing the budget pressure of pension liabilities, investing in the expansion of revenue-producing industries, and attracting our best students, our best future assets, to stay in Illinois rather than going to college elsewhere. And I'll certainly work to continue to address our long-term structural challenges in the coming session of the legislature. We must. Addressing Illinois' long-term fiscal challenges that existed when I became governor will continue to be among my very top priorities. But today I want to tell you about a portion of how we will address the short-term COVID-related fiscal issues that we face. The president-elect and the U.S. House of Representatives have pledged to provide state and local stimulus funding to assist us with the short-term deficits that COVID has created across the nation. Because there has been movement among a bipartisan group of senators to support that stimulus, our confidence level is rising, although it remains modest. In addition, the potential for delivery of vaccines in the coming months will help our economy recover, and therefore our state revenues may also see modest improvement. Those two factors improve the likelihood that we will receive help to overcome the short-term deficit that Illinois faces this year. As you know, the Federal Reserve is allowing states to borrow short-term funds to help weather the financial storm created by the COVID-19 pandemic. Back in May, when the budget was passed in the midst of the first wave of the virus, it was unclear how much potential short-term borrowing would be necessary. But we did know that it would likely be one of the tools that we would employ to help us manage our way through this challenging fiscal year. Although the General Assembly authorized as much as $5 billion of borrowing from the Federal Reserve, I am very reluctant to saddle our state with that large an amount of short-term debt. I believe it would be irresponsible to borrow that entire amount given the persistent fiscal pain it would cause over the next 3 years as we would struggle to repay that entire amount. Today is the day we must give notice to the Fed of the amount we intend to borrow. So in light of this pandemic's effects on our state's fiscal condition and my insistence that we look beyond this year to our state's longer-term fiscal condition, today we have notified the Federal Reserve of our intent to borrow only $2 billion, less than half of the $5 billion that's been offered to us by the federal government. This was a joint decision that I made after close consultation with Comptroller Mendoza and Treasurer Frerichs, and I want to thank them both for working together on this short-term strategy to manage the near-term financial challenges brought on by the pandemic. Our collective intention is to repay this line of credit as early as possible after either the awarding of stimulus by Congress or a sufficient recovery of state revenues. It is also important to recognize that we would not have had this tool available to us without the approval of the General Assembly back in May. Let me be clear. While we will continue to take every step we can to manage our way through this crisis, adding debt is not a long-term solution to structural imbalance. Short-term borrowing is a short-term Band-Aid to address the urgency of a short-term problem like one caused by a pandemic. Our long-term fiscal health must also be addressed, but not with short-term borrowing. I have been communicating with leaders and members of the General Assembly to get their input and best ideas to address the long-term fiscal health of our state. I intend to continue working with them over the coming weeks and months to identify the various means by which we will bring long-term stability and balance to our state's fiscal situation. Our goal with this short-term borrowing is to continue managing our backlog responsibly and fight to rebuild jobs and the economy over the coming year. It's my firm belief that short-term stimulus and near-term revenue recovery must be used to repay short-term borrowing from the Federal Reserve. So now moving on to our normal COVID update, I want to start with some good news. As of today, Illinois has tested more than 10 million specimens since the beginning of this pandemic, with more than 1 million done in just the last 10 days. That comes as we are now averaging more than 106,000 tests per day, also a new high for Illinois. Of course, for all that we've done to prepare our physical testing infrastructure for a surge, the simple limits of our laboratories during a time of immense demand across the nation, like we've seen in these days prior to Thanksgiving, have started to lead to longer lines and longer test turnaround times, even at our state labs. While we're doing everything in our power to meet the interest, I want to remind everyone that if you're experiencing symptoms, or if you had close contact with someone who tested positive, or just has concerning symptoms themselves, you should quarantine, even from your family, for 14 days. Remember, even if you test negative, it's possible that you were in fact exposed, and it's just too early for the virus to show up on a test. So don't think of a negative test as any kind of free pass. That's especially true going into this holiday weekend. The safest thing we can do for one another is stay within our own households. But if you are hell-bent on gathering with others outside your own home, please do it with just a few people. And importantly, this is not the year to have everybody over at grandma's house. I know this isn't what anybody wants to hear, but we also know that this crisis may come to an end in just a few months. Every day that we take action to stop the spread gets us one day closer to widespread distribution of the vaccines, with fewer lives lost along the way. Just as importantly, every day we throw caution to the wind, even if it's a holiday, is a day we backtrack on any progress that we've made for our healthcare workers, many of whom don't get to see their families on holidays in normal times. People like Becky Walfeld, the registered nurse clinical lead at Unity Point Health's ICU in Peoria. Becky has been a leader in setting up a new COVID care ICU at UPH Methodist, sitting at the bedside of sick patients with technology so they can communicate with their loved ones at a distance. Or Terry Lamar, an infection prevention and employee health nurse at Touchette Regional Hospital in Metro East. She has tested and educated countless employees and patients for the COVID-19 virus, dedicating countless after-work hours monitoring results and talking patients through their plan of care. Or Dr. Marianne Miller of the Javon Bay Hospital System in Rockford, who designed COVID-19 units in the spring while also providing direct care to patients. Dr. Miller is now hard at work designing alternate care models to help care for the many critically ill patients in Rockford during this second surge. There's too many for the hospital to support the same way as it did in the spring. So tomorrow, this weekend, and just a few months longer, think about Becky, Terry, and Marianne and their families. Think about your own family. Stay home when you can. Avoid gathering. Wear a mask. Keep your distance. And if you haven't yet, put your mask on and go get your flu shot. Doing so helps reduce the spread of that virus, helping our hospital systems better manage this pandemic by reducing the number of critically ill flu patients they have to care for at the same time. Shop small businesses online, and if you'd like, maybe start planning ahead for all the great celebrations and weddings and gatherings that you'll have when this is all over. We can get through this safely. We know how. So let's use the tools that we have, and remember, the best way through this is working together. Have a wonderful and safe Thanksgiving weekend, everyone. And now I'd like to turn it over to Dr. Ezike.
Thank you, Governor. And I just want to share that among the things that I'm most thankful for, Governor, is your steadfast leadership through one of the most trying times of our lives. So thank you. And for everyone, I want to wish you a happy Thanksgiving and a very safe one. I'd like to try to implore one more time for people who may still be planning that get together with multiple households and friends who are not in their immediate household to please, please, please reconsider. We don't want anybody's Thanksgiving dinner to turn into a COVID-19 super spreader event. Our goal is to protect and not infect those that we love and care for. My fear is that 2 weeks from now, we'll start seeing a new spike in cases or hospitalizations because people from various households gather to celebrate Thanksgiving. Please be a part of the solution and not part of the problem, and let's decrease the spread of this virus. Since yesterday, 11,378 new cases of COVID-19 were reported, for a total of 685,467 cases in Illinois. Unfortunately, it was reported that 155 additional lives were lost, for a total of 11,832 deaths just here in the state of Illinois. These are our mothers and our brothers and our sisters and our grandparents and so many loved ones who aren't going to be with us at the Thanksgiving table or any future holiday. 6,133 individuals were reported to be in the hospital overnight with COVID-19, and of those, 1,208 patients were in the ICU and 679 were on ventilators. In the last 24 hours, more than 114,000 tests have been reported, for a total of more than 10.1 million tests in the state of Illinois. And speaking of testing, if you do gather for the Thanksgiving holiday, remember to get tested afterwards. You can't test out of quarantine if you think you've been exposed, but please know that you can find a list of testing locations on our website, including the 11 community-based testing sites where anyone can get tested at absolutely no cost to you directly. Our testing sites are open on Friday, but of course remember that you have to wait at least a minimum of 7 days after you think you may have been exposed to get tested. And as the governor said, if you're thinking of shopping, if you're shopping on Black Friday, don't forget your local stores and see if you can shop them online. And you can purchase gift certificates from your favorite stores and give it as a gift to be used in the coming year. While it will look different and perhaps not at all how we want, let's try to make this upcoming holiday season one of cheer and not one of fear for more COVID-19 illnesses and lives lost that could have been prevented. Have a safe, blessed, and happy Thanksgiving. And as always, wear your mask, watch your distance, and wash your hands. And of course, also get your flu shot. Thank you. Buenas tardes a todos. Antes de mañana quiero mandar un feliz Día de Acción de Gracias a todos. También me gustaría pedir una vez más que las personas que todavía estén planeando juntarse con amigos y familiares que no viven en su casa, por favor no lo hagan. No queremos que las cenas de acción de gracias se conviertan en brotes de COVID-19. Adentro de una semana o 2 semanas, vamos a empezar a ver un aumento adicional en los casos, gente en el hospital y las muertes, porque personas de varias casas se juntaron para celebrar el Día de Acción de Gracias. Por favor, sea parte de la solución y no parte del problema. Y ayúdenos a frenar la propagación de este virus mortal. Desde ayer se han reportado 11,378 nuevos casos de COVID-19 para un total de más de 685,000 casos en Illinois. Esto incluye 155 vidas perdidas en las últimas 24 horas para un total de más de 11,800 muertes solo aquí en Illinois. Estos son madres y hermanos y hermanas y padres y abuelos y otros familiares que no se unirán a nosotros en la mesa de acción de gracias. 6,133 personas pasaron la noche en el hospital con COVID-19. De ellos, 1,208 pacientes estaban en la unidad de cuidados intensivos y 679 pacientes estaban en ventiladores. En las últimas 24 horas se han reportado más de 114,000 pruebas fueron hechas para un total de más de 10.1 millones de pruebas aquí en Illinois. Hablando de pruebas, si se reunirse para el Día de Acción de Gracias, tómese un tiempo después para hacerse la prueba de COVID-19. Puede encontrar una lista de sitios de pruebas en nuestro sitio web. La gente debe esperar 5 a 7 días después de que crea que ha estado expuesta para hacerse la prueba. Los sitios de pruebas estatales estarán abiertos el viernes. Y si está pensando en comprar el Black Friday, le recomendamos que compre en las tiendas locales por internet. También puede comprar un certificado de regalo en una de sus tiendas favoritas y dárselo como regalo para usarlo el próximo año. Sí, los días festivos se verán diferente y tal vez no será como queremos este año, pero tenemos que hacer lo más que podemos para salir adelante contra este virus. Tengo un feliz Día de Acción de Gracias y como siempre, sigan los 3 M's. Usan su máscara, mantenga su distancia y lávese las manos. Y también vacúnese contra la influenza. Muchísimas gracias por su apoyo. And with that, I will turn it back over to Governor Pritzker.
All right, we'll start with some questions from reporters. We'll start with Greg Bishop at the Center Square. With the revelations from the public hearings on LaSalle, wouldn't it be beneficial for more public hearings and scrutiny on other COVID-19 issues? Wouldn't such hearings help save lives?
Well, the legislature is absolutely free to hold hearings. I think they have been holding hearings, and I look forward to the recommendations that come out of that.
Jim Hagerty at the Rockford Advocate. Governor, you said you hoped to lift Tier 3 restrictions before the December holidays. Do 2 incubation periods give you sufficient time to gauge whether that will be possible, or should Illinoisans prepare to be under restrictions through December?
Well, this is all going to be dependent upon whether people are following the mitigations. My hope, my goal was sooner is better than later, of course, for us to get out of Tier 3 resurgence mitigations. But it will, again, be dependent upon metrics, not a time frame. We've set out the metrics for reducing mitigations on a regional basis from Tier 3 to Tier 2, Tier 2 to Tier 1, and then back to the Phase 4 mitigations that were in place before we went to this regional plan.
Eric at ABC7, wishing you all a safe holiday. If people go against the guidance in travel and mixed households, should they plan on getting tested next week, and when? And also, how is the state preparing for what will likely be a huge testing demand after Thanksgiving?
Dr. Ezike, you want to talk about testing after coming back from Thanksgiving?
Sure. So we know that it can take up to 14 days to show the signs of infection if you actually got infected. But most people will show a positive test if they're going to at day 7. So we would like people to wait at least a week. Obviously, if you develop symptoms before then, please test immediately. And in the meantime, always wear your mask and try to keep distance if you know that you've been in a high-risk setting, and if you know you potentially could come in contact with others. Please take the precautions even before you get a test result while you're waiting to get that test and get the results.
And Eric, just to answer the other part of your question, we're always working to expand testing. So when you say, how are you preparing for a surge of demand? I just want to be clear, if I could double or triple the number of tests that could be done and could run through the labs that are available to us in a short time frame so you can get an answer quickly, I would do that today. I would make that available to everyone. And so every day you've seen that we've been trying to move the numbers of tests available to people up and up and up. We've got these antigen tests that are adding on top of it. We're working to expand saliva test availability and, of course, the basic PCR tests.
Joel at the Daily Line, given the results of the fair tax, would the governor consider putting the issue on the ballot in future years, or did the voters send a strong message that they want the state to take a different approach?
Well, that's not something I'm considering right now, but you know that I really do believe that a graduated income tax system is much fairer for the middle class, for the working class, and frankly, it's important for us to work to make our tax system more fair in every way that we can. The fair tax would have been the best way to do that, but look, there were billionaires and well-heeled Republicans and basically universally the Republican Party that opposed giving a tax break to the middle class and those striving to get there, and opposed taxing the wealthiest people in our state a little bit more. So, here we are in the situation of having to find other avenues to balance our budget and to meet the demands of a structural deficit for our state. But we'll get there. It just won't be, frankly, as fair as if we had been able to pass the fair tax.
Dan Petrella at the Tribune has a question for Dr. Ezike. What will you be watching for as the first indication of a possible post-Thanksgiving surge?
Right. So that's a great question, Dan. So again, the first thing that will happen will be the number of cases will increase. You obviously have to have a positive case before you get people who end up in the hospital, before you have people, that end up on ventilators or unfortunately pass on. So following in the week or two following Thanksgiving, if we start to see an increase in the number of cases, that will be a sign that maybe there was some spreading at the Thanksgiving holiday.
Patrick at the Illinois, COGFA reports that income tax revenues are actually up so far this year, yet the budget still has a $4 billion hole. There are some legislative Democrats who say they expect you to push forward a tax increase in the lame duck session. Is that your plan?
I think I've been pretty transparent with where we are right now, which is we're going to have to start with looking at cuts to state government. And I think, to get where we need to go, some of those cuts are going to have to be relatively painful. I have met with the leaders. I have consulted with members of the General Assembly to get their best ideas about what it is that we can cut. Look, I've brought a lot of efficiencies to state government since becoming governor. We've expanded our software, our ERP system, to cover 95% of all of the agencies of state government. Before I came in office, we weren't even close. That ERP system allows us to bring efficiencies going forward. So that's some of what we've done. We've made cuts internally across state government, but there's much more that needs to be done. And so I'm looking for those best ideas from people on both sides of the aisle.
These will be our final questions. We don't have anything else in the portal, but Jerry at Capital News Illinois, Nick at Bloomberg, and Petrella at the Tribune all are asking, is the $2 billion in borrowing in addition to the $1.2 billion from the MLF in the previous fiscal year, and has there been any repayment of that $1.2 billion?
The $1.2 billion is from the prior fiscal year. You're correct in that. And we have not repaid the $1.2 billion. But as I say, we're in the borrowing this year. We're going to be able to at least cover the short-term losses, from COVID-19. We still have much more work to do, as I've said, to balance the budget, and I'm looking to the legislature to help us do that. But essentially, the last year's borrowing was to cover the losses in the last quarter of last fiscal year. The pandemic started, as you know, really in February, and really began to hit our economy significantly in our revenue in March. So that's from that period of time, and this $2 billion is really to try to cover a portion of the losses from this fiscal year. And to remind everybody, our intention is at our earliest date, whether we receive stimulus or have significant greater recovery of revenues to the state as the economy improves, we're going to look to repay that borrowing as soon as possible.
I actually forgot one from David at the Sun-Times, and there were a couple other people who asked the same question. The McHenry County States Attorney says he is not going to enforce your indoor dining ban. Can you just give us your reaction to that?
Surprising that a state's attorney doesn't want to follow the law. These are the laws of the state of Illinois, and other jurisdictions are following the law and prosecuting these fines, and that's what they are, fines. For businesses that are failing to follow the mitigations or they're opening their doors if they're bars and, spreading the virus willy-nilly at a time when we're undergoing really a terrible second wave of the virus. So, I would hope that officers of the court, like state's attorneys, would follow the laws of the state of Illinois and do the right thing, because people are getting sick. If you don't do the right thing, more people are going to get sick.
All right, that is everyone. Thanks for your time. Have a good Thanksgiving, and we'll see you guys next week.
Happy Thanksgiving, everyone.